Hello, and welcome back. Did you know that over 800,000 people suffer a heart attack each year in the US alone? What's even more surprising? Some of the medications you take daily could be increasing your risk, without you even realizing it. From common pain relievers to antidepressants, research has linked several widely used medications to heart problems. But don't worry. In this video, we'll break down 8 medications that might be silently impacting your heart and what you can do to stay safe. Let's dive in. 1. NSAIDs, non-steroidal anti-inflammatory drugs. Medications like ibuprofen, Advil, Motrin, and naproxen, Aleve, are go-to solutions for pain, inflammation, and fever. While they work well for short-term relief, studies show that even using them for just 1 week can increase the risk of a heart attack by 20 to 50%, depending on the dosage. NSAIDs can raise blood pressure, cause fluid retention, and constrict arteries, making your heart work harder. Over time, this extra strain increases the risk of blood clots, heart attacks, and strokes, especially for those with existing heart conditions. What can you do? Try using the lowest possible dose for the shortest duration. If you need frequent pain relief, consider alternatives like acetaminophen, Tylenol, physical therapy, or natural anti-inflammatory options like turmeric and ginger. And as always, check with your doctor before prolonged use. 2. Some antidepressants. Medications like fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine, Effexor, are widely used to treat depression and anxiety. While they're effective, research suggests they may increase the risk of heart-related issues, especially in people with existing heart conditions. A study in JAMA Psychiatry found that certain antidepressants can lead to irregular heart rhythms, blood clot formation, and higher blood pressure. They can also affect blood clotting, which may increase the risk of strokes or bleeding complications. The benefits of antidepressants often outweigh the risks, but if you have heart concerns, talk to your doctor. Cognitive behavioral therapy, CBT, exercise, and dietary changes can also help support mental health. And remember, never stop these medications suddenly. Always taper off under medical supervision. 3. Calcium channel blockers. These medications, including amlodipine, Norvasc, and diltiazem, cardizem, are used to treat high blood pressure and chest pain. They work by relaxing blood vessels, making it easier for the heart to pump blood. However, some studies suggest that long-term or high-dose use of CCBs could increase the risk of heart attacks and heart failure. They can also cause fluid retention, dizziness, and irregular heartbeats, especially in people with heart disease. If you're on a CCB, keep an eye out for side effects like swelling, dizziness, or an irregular heartbeat. Ask your doctor if alternatives like ACE inhibitors or beta blockers might be a safer option for you. 4. Diabetes. Medications. Certain diabetes medications, especially older drugs like rosiglitazone, have been linked to a higher risk of heart attacks and heart-related deaths. A landmark study in the New England Journal of Medicine found that rosiglitazone was associated with a 43% increased risk of heart attacks and a 64% higher risk of cardiovascular death. These drugs can cause fluid retention, leading to high blood pressure and extra strain on the heart. If you're on a diabetes medication, talk to your doctor about safer options like metformin, SGLT2 inhibitors, or GLP-1 receptor agonists. Lifestyle changes, like a healthy diet and regular exercise, can also help manage blood sugar while protecting your heart. 5. Decongestants. Got a stuffy nose? Many people turn to pseudoephedrine, Sudafed, and phenylephrine, common ingredients in over-the-counter cold and flu medications. While they're great for clearing up congestion, these medications can raise blood pressure and heart rate, putting extra strain on your heart. A study in the American Journal of Medicine found that pseudoephedrine use significantly increases the risk of heart attacks, especially in people with high blood pressure or heart disease. If you have high blood pressure or heart concerns, skip decongestants and try steam inhalation, saline nasal sprays, or antihistamines instead. Always check medication labels and consult your doctor if you're unsure. 6. Chemotherapy drugs. Chemotherapy is life-saving, but certain cancer drugs, like doxorubicin and fluorouracil, can have serious effects on the heart. These drugs have been linked to heart muscle damage, irregular heart rhythms, and even heart failure. One study found that doxorubicin led to heart failure in up to 26% of patients, especially when taken at high doses. If you or a loved one is undergoing chemotherapy, your doctor may monitor your heart health with regular echocardiograms. Some protective medications can help, and lifestyle factors like a heart-healthy diet and regular physical activity can also make a difference. 7. Testosterone and anabolic steroids. Testosterone therapy and anabolic steroids are sometimes used for muscle growth, athletic performance, or treating low testosterone. However, these substances can increase the risk of heart attacks, strokes, and blood clots. A 2017 study found that men who started testosterone therapy had a 30% higher risk of heart attacks and strokes within the first 3 months. These substances can also lead to high blood pressure, artery blockages, and even sudden cardiac death. If you're considering testosterone therapy, only use it under medical supervision. Instead of steroids, focus on natural ways to boost testosterone, like strength training, healthy fats, and quality sleep. 8. Some heartburn medications, PPIs. Proton pump inhibitors, PPIs, like omeprazole, Prilosec, and esomeprazole, Nexium, are widely used to treat acid reflux. However, long-term use has been linked to higher risks of heart attacks, magnesium deficiency, and blood clot formation. A Stanford University study found that PPI users had a 16 to 21% increased risk of heart attacks, even if they had no prior heart disease. These drugs may also lead to stiffer arteries and higher blood pressure over time. If you rely on PPIs, consider safer alternatives like H2 blockers, dietary adjustments, and natural remedies like ginger, aloe vera, and probiotics. Always consult your doctor if long-term treatment is needed. Final thoughts. Your health is in your hands. While medications can be life-saving, it's important to be aware of potential risks, especially when it comes to your heart. If you found this video helpful, give it a thumbs up and share it with others who might need this information. Don't forget to subscribe for more health tips.